They handed the new nurse the deaf veteran because they thought it would be funny. Welcome back to Steady Badge's Stories. I'm glad you're here today. Before we get into this one, if these stories about quiet people doing extraordinary things mean something to you, go ahead and hit that like button, hit subscribe, and drop a comment telling me where in Canada you're listening from. I want to know how far this travels. Now settle in because this one matters. Jocelyn Farr had been at Ridgewood Veterans Care Centre for 22 days. 22 days of arriving early, charting late, and the rooms nobody else wanted. 22 days of being called the new one by doctors who couldn't be bothered to read her name badge. 22 days of keeping her head down because invisibility, she had learned long before this, was a form of armor. She wore navy blue scrubs that fit loosely at the shoulders. Her dark hair was pulled into a low knot, practical and uninteresting. She was 38 years old, and she had cultivated the particular stillness of someone who had survived rooms far more dangerous than a ward in Petawawa, Ontario. Ridgewood served veterans from CFB Petawawa and surrounding communities, soldiers who had come home from Afghanistan, Bosnia, Somalia, and a dozen other places the news had briefly covered and quickly forgotten. The building smelled of antiseptic and old coffee, and something underneath both of those that Jocelyn recognized as the exhaustion of people who had been waiting a long time to feel heard. She was restocking the medication cart when Rhonda Kinsley appeared at the nurse's station. Rhonda was the senior charge nurse. She had worked at Ridgewood for 14 years, which she mentioned frequently and used as a kind of personal currency. She tapped the desk with her pen, a habit she had when she was about to enjoy herself. Far. She didn't look up from the scheduling board. Room 7. Sergeant Major Rhys Dutton retired. Royal Canadian Regiment. Bilateral profound hearing loss after an IED in Kandahar province. Won't read lips, won't cooperate, won't let anyone examine him unless he decides he likes them. She paused for effect, which he never does. Pete Huang, a second-year resident standing near the printer, laughed into his coffee. 3 nurses tried last week. 1 cried in the supply closet. 2 staff members near the window smiled at their phones. Dr. Sterling Boyce stepped out of the physician workroom without looking up from his tablet. He was polished in the way of men who had decided early that confidence and competence were the same thing. He looked at Jocelyn the way he looked at the chairs, as furniture placed in the wrong hallway. Farr, he said, getting the name right for once as if the chart had reminded him. Vitals, pain assessment, breathing treatment if he'll accept it. Don't escalate. Don't waste my afternoon. Pete lifted his phone slightly, angling it toward the hallway. Should we document this for orientation purposes? Light laughter followed. Jocelyn kept her face exactly as it was. That seemed to disappoint them. Boyce handed her the chart. Rhys Dutton. 61 years old, Major Royal Canadian Regiment, bilateral profound hearing loss, post-blast injury, Kandahar Province, 2009, left below knee amputation, same event. Admitted 3 days ago following collapse at the Petawawa Prosthetic Fitting Clinic, fever, tachycardia, right lateral chest pain, X-ray pending. The red notation appeared twice in the file, combative, non-compliant. Jocelyn had always hated those words. In her experience, they usually meant someone had stopped trying to understand a patient and started blaming him for it. She walked to room 7. Through the narrow window in the door, she saw him. Rhys Dutton sat upright with his back against the wall, not the pillow, the actual wall. His eyes moved steadily, door, window, oxygen panel, sharps container, not fear, threat assessment. He was a broad man, even in a hospital gown, with a close-cropped gray beard and a scar that ran from his left brow into his hairline. His eyes were pale gray and watchful and entirely awake. He wasn't combative. He was doing what soldiers did when they couldn't trust the room. A whiteboard beside the bed read, "Patient is daft." The tablet lay face down on the floor, cracked. Jocelyn knocked twice on the doorframe. His eyes went immediately to her hands. Good, he was watching the right place. She entered slowly, palms open and visible, body angled so the door stayed in both their sightlines. She raised her hands. "My name is Jocelyn. I am your nurse. I will not touch you without asking first." He went still, not because she signed, because she signed well, without the hesitation of someone who had learned it from a weekend course or a YouTube tutorial. His hands came up. "You sign." "Yes." "How?" "My brother is deaf, and I had other reasons to learn." He studied her for a long moment. "No students in here?" "Not without your permission." "No Boyce?" "He goes where you allow him, not before." Something shifted at the corner of his mouth, not a smile, more like a door opening a crack. "What did they tell you about me?" She didn't soften it, "That you are difficult." "And you?" "I think you are in pain, and that nobody here has taken the time to understand that." The room settled around that sentence the way rooms sometimes did when something honest entered them. He nodded once. She wrapped the blood pressure cuff around his arm, asking permission first, touching with warning. No sudden pressure, no cold metal, no grip that reminded a body of restraint. The numbers were wrong, 162/96. Pulse 128, oxygen 91, temperature 101.1 Fahrenheit. She counted his respirations herself, 30 per minute, too fast. His right hand pressed against his lower ribs throughout. She pointed. Pain there? Yes. Since when? This morning, worse after the clinic yesterday. Sharp or tight? Tight, hard to get a full breath. She listened to his lungs, asking first, waiting, left side clear, right lower field diminished, not absent, not yet, but wrong enough to matter. She stepped back. You need reassessment. Your chart says anxiety. I think your chart is wrong. He watched her face for a long time. The way someone does when they've been dismissed enough times that honesty no longer registers immediately. Then his hands moved differently. Shorter signals, no grammar, no flow. Tactical shorthand. The kind used in environments where light and sound were liabilities and a misread gesture could cost someone their life. Right side, pressure building, hard breath, internal. The coldness that went through Jocelyn then was not surprise, it was recognition. No nurse trained only in a hospital would have understood those signals. They weren't ASL, they were field code. The kind used by Joint Task Force 2 operators moving through darkness with no radio contact and no margin for error. Dutton saw her face change before she could stop it. His hands repeated the sequence, then added one word, identify. She should have looked confused. Confusion would have been the safe choice. Instead, she watched his oxygen drop to 89 and answered with one signal, hold, I see you. Dutton stopped breathing for a half second. His eyes dropped to her left wrist, where her watch covered a thin, pale scar. The kind left by a harness line pulled too hard against bare skin under pressure, in the dark years ago. His hands moved slower. Kestrel? Jocelyn stepped back. No, Kestrel is dead. Then let her stay that way. The door opened before he could sign again. Rhonda stood in the frame with Pete behind her, phone visible. Why is the privacy curtain pulled? Because he deserves privacy, Jocelyn said. Pete smiled. Or because you're in over your head. Jocelyn moved into the hallway, her voice stayed even. Room 7 needs Dr. Boyce now, his status has changed. Boyce arrived with his tablet and the particular impatience of men who believe their time is worth more than whatever the situation in front of them turns out to be. What did he do? He didn't do anything. Jocelyn read from her notes without inflection. Pulse 128 and climbing. Respirations 30 per minute. Fever 101.1. Oxygen dropped from 91 to 89 in 12 minutes. Right side breath sounds diminished. Acute chest pain that worsened following clinic yesterday. Boyce glanced through the window at Dutton and performed a calculation that was not medical. PTSD pain response. Hyperventilation pattern. Document anxiety and order a mild sedative. That's not what's happening. It's the documented history. His oxygen numbers don't fit hyperventilation. His breath sounds don't fit anxiety. He needs his imaging reviewed. Boyce's voice hardened into something practiced. You have been here 22 days. I have been here 11 years. I am not going to debate respiratory physiology with a nurse who hasn't finished her probationary period. He leaned slightly closer. Document anxiety, order the sedative, that is a direct instruction. Clear, Jocelyn said. She returned to the room. Clear did not mean obedient. It meant she understood exactly what kind of man was standing between Dutton and the care he needed, and that she had stopped waiting for him to move. Inside, Dutton signed as soon as the door closed. Doctor is wrong. Yes. You going to fix it? I'm going to try. His hand pressed harder into his ribs. The monitor climbed to 134, oxygen 87. She placed the non-rebreather mask after he nodded. He didn't resist, didn't flinch, didn't reach for her wrist. That alone would have shocked the hallway. She adjusted the flow and watched his chest. Then he signed in field code again, worse, fast now. She hit the rapid response button herself. The overhead crackled through the ward. Rapid response room 7. Rapid response room 7. Boyce came around the corner and immediately reached for the cancel switch. Dutton's hand closed around his wrist. Not hard enough to injure, precisely hard enough to stop. Jocelyn signed once to Dutton, release. He released immediately. That obedience, immediate clean from a man who had refused every other person in the building, silenced the 3 people watching from the doorway. Dr. Vivian Saad from Thoracics arrived first, moving with the quiet efficiency of someone who had learned to read a room before she read the chart. What have you got? Jocelyn spoke quickly. 61-year-old male, profoundly deaf, ASL primary, 3 days post-admission. Right-sided chest pain, worsening dyspnoea, diminished right lower breath sounds. Oxygen sitting at 86 on high flow. Pulse 136, fever 101.1. He had a right lower field that was diminished on auscultation 40 minutes ago and has since dropped further. Boyce stepped forward, anxiety presentation in a documented PTSD patient. Vivian listened to Dutton's chest. Her expression changed in the particular way that good physicians' expressions changed when the body understood something before the mouth had caught up. She called for portable imaging and did not look at Boyce when she did it. Anxiety doesn't remove breath sounds from one side of a chest. The X-ray loaded while Dutton's oxygen sat at 82. Jocelyn stood where he could see her hands. Slow breath, eyes on me. He signed back weakly. You came back. Stay alive and complain about it later. The image appeared. Vivian leaned in. The room went quiet in the way. Rooms went quiet when the picture confirmed the thing everyone should have caught earlier. Right pneumothorax. Boyce stared at the screen. Jocelyn opened the 14-gauge catheter. Boyce snapped. Stop, he needs decompression. You are not cleared for independent procedure. Dutton caught her sleeve and signed against her palm. You do it, I consent. Consent given, Jocelyn said clearly. Absolutely not. She had already cleaned the site. Second intercostal space, midclavicular line. She adjusted slightly for the scar tissue she could feel shifting the anatomy. Controlled pressure. The catheter went in. 1 second of nothing. Then the hiss. Air under pressure escaping. Dutton dragged in a breath, full breath, the kind that had been impossible for hours. The monitor climbed. 82, 85, 89, 92. Vivian secured the line and checked placement. Jocelyn stepped back. Her hands did not shake, not at all. Rhonda had gone pale near the doorway. Pete's phone had disappeared into his pocket. Vivian looked at Boyce. The question she asked had no softness in it. Why didn't you decompress him? No one breathed. I was still assessing. It was at 82% saturation. She turned to Jocelyn. Good save, chest tube now. 2 words, good save. They landed harder than any insult had. Jocelyn looked at the floor for exactly 1 second. No blood here, no smoke in the rafters, no helicopter rotors shaking the walls. But her body remembered a colder room in a darker place. A room where a man had gasped with the same sound Dutton had made, and a decision had been delayed too long because someone needed permission before they were willing to be right. She pushed that memory down. Dutton needed present time, not ghosts. 3 hours later, he was stable in step-down. His color had returned. Vivian had ordered the chest tube, antibiotics, careful pain management, and absolutely no sedation without respiratory review. Boyce had hated every word of it. Jocelyn documented everything, every vital sign, every delay, every refusal, every instruction she had received, and the order in which she had received them. Facts were cleaner than grievances. They just needed to be precise. At 4:15, Rhonda found her in the supply room. Administration wants you. Is Dutton stable? Vivienne's with him. Then I'll go. Rhonda blocked the doorway for a moment. Her face was different than it had been that morning. Smaller. Jocelyn. Jocelyn waited. I laughed. When Boyce handed you the chart, I want you to know I'm aware of that. Humiliation is never harmless. It only looks small to the people who are watching. Rhonda flinched. She held it rather than flinching away from it, which was something. The administrative boardroom on the 3rd floor was insulated from alarms and urgency. Framed values lined the walls. Respect, integrity, service. Jocelyn had noticed before that institutions which truly lived by their values rarely needed to display them in frames. Administrator Norma Quinn sat at the head of the table, Boyce to her right, Pete beside him. Rhonda took the chair nearest the exit. Nurse Farr, Quinn said, please sit. I'd prefer to stand. Boyce made a sound. Quinn tapped her pen. We're reviewing an unauthorized clinical intervention. A life-saving one. That determination is not yours to make. His oxygen saturation made it. Quinn pressed on. You performed needle decompression without attending physician authorization. You were explicitly instructed not to proceed. You understand why that constitutes a serious breach. I understand the liability concern. The clinical concern was that he was dying. Silence. Quinn looked up. You seem very calm for someone facing termination. Jocelyn said nothing. Calm had been trained into her in environments where panic moved faster than the threat itself. Boyce opened a folder. There is a secondary concern. Sergeant Major Dutton addressed you by a term, a word. He checked his notes. Kestrel. Quinn looked between them. What does that mean? Ask him. We're asking you. I don't know what he meant. Boyce smiled. That's a lie. Something's changed in the room's air. Subtle. Enough for Rhonda to sit straighter without knowing why. Jocelyn turned her head toward him. Her voice did not change. You should be careful with that word. Or what? That depends on how many more patients you plan to let deteriorate while you protect your own clinical record. Quinn struck the table. This review is not about Dr. Boyce. Boyce stood. You are not some kind of hero here, Farr. This is a care facility. We have protocols. We have structure. Jocelyn held his gaze. Structure doesn't oxygenate a patient, Dr. Boyce. The door opened. Vivienne Saad walked in with Dutton's updated chart. I heard there was a review. Quinn's smile was strained. This is an internal matter. It's a patient safety matter. Vivienne placed the report on the table without ceremony. Sergeant Major Dutton had a clinically significant tension pneumothorax. Without decompression at the time Nurse Farr performed it, his outcome would have been substantially worse. She acted correctly, within the scope of an emergency, with expressed patient consent in his primary language. Boyce stared at the wall. Quinn, did the patient consent? In ASL, Jocelyn said, Then I'll defend the intervention. Vivienne looked at Quinn with the patience of someone who had defended right decisions in administrative rooms before and expected to do so again. Scope matters, so does survival. The door opened a second time. The room went quiet. Rhys Dutton stood in the doorway in his hospital gown, chest tube chamber gripped in his right hand, IV pole in his left. The step-down nurse appeared behind him looking stricken. I'm sorry, I tried. He walked past her and looked at Jocelyn. Translate, exactly. She looked at him for one long moment, then, he wants me to translate. He signed, slow and deliberate, watching her face to make sure every word came through. Jocelyn's voice was flat and clear. He says, She saved my life, you mocked me, you spoke over me, you tried to sedate me because it was easier than understanding me. She looked at Boyce, and you let me deteriorate while you protected your own assessment. Rhonda covered her eyes. Pete looked at the table. Dutton pointed at Jocelyn, then switched to field code, not ASL. Identity confirmed, Kestrel alive. She didn't translate that. He knew she wouldn't, so he spoke instead. His voice was rough from years of not hearing himself, but the word came out precisely. Kestrel. He pointed at her. Quinn whispered, She was there. Dutton looked at Boyce for a long moment, then said, in the careful, deliberate voice of a man who had taught himself to speak again after silence had taken everything. Where men like him would have lasted 10 minutes. His knees went. Jocelyn caught him before anyone else in the room had processed what was happening. Major Elwood Chandler of the Canadian Forces National Investigation Service arrived the next morning with 2 investigators. He stopped when he saw Jocelyn in the step-down corridor, and the recognition on his face was the kind that doesn't need explanation. Kestrel. She looked at him. Major. The drive authenticated this morning. She had found the chip the previous evening, waterproof, smaller than a thumbnail, hidden inside the foam lining of Dutton's worn prosthetics sleeve, not the case that had been taken from the prosthetics lab. The case was bait. He had known someone might come for it. The liner was what he had protected. The chip contained procurement records, altered after action reports, and medical assessments that had been falsified to protect decisions made by people who valued their careers more than the soldiers their signatures were attached to. Dutton had filed a formal complaint 18 months earlier. His file showed that complaint had never been reviewed. Boyce's signature appeared on the document that had buried it. Not for payment, for convenience. The men who had come for the drive, one in a reversed maintenance badge, one from a private defense contractor connected to Operation Meridian, the classified mission that had put Jocelyn in a sealed file marked deceased, had been intercepted before any patient was harmed. She had seen the wrong badge, the wrong shoes, the 2 clean hands of a man pretending at work he had never done, and she had made the calls she needed to make before he reached the ward. Some training didn't leave the body no matter how long you asked it to. Your sealed status collapses when this goes through federal review, Chandler said. I know. There are people who will want you moved, protected. She looked through the window at Dutton, then at Rhonda down the hall, practicing signs slowly with a volunteer who was correcting her without mercy. I know. Do you want extraction? No. He watched her carefully. I'm not asking as your commanding officer. That's not what I am anymore. Good, she said, because I'm answering as a nurse. Boyce confessed enough within 4 days to end his career and open 3 federal investigations. Quinn was suspended pending a formal review. Pete Huang entered a remediation process that his supervisor told him would be the most important thing he'd do in his residency. Not because of what was required of him, but because of what he chose to do beyond it. His note to Jocelyn 3 weeks later was one sentence. I will be better than I was that day. She kept it in the breast pocket of her scrubs for the rest of that month. Rhonda stayed. That was what surprised Jocelyn most. She had expected a transfer request, or the slow retreat of someone waiting to be forgotten. Instead, Rhonda arrived early and stayed late and signed up for the first ASL class, Ridgewood had ever offered on its own premises. She practiced with an elderly warrant officer in room 4 who corrected her without kindness and seemed to enjoy having something useful to do. One afternoon, Jocelyn found her in room 9 signing, "Where is the pain?" to a deaf veteran who had refused all care for 2 days. He pointed to his hip. Rhonda looked it up. She went and got someone who could help. Jocelyn stood in the doorway and didn't speak. Rhonda saw her and went still, waiting. Jocelyn nodded once. Not forgiveness. That was Rhonda's work to do over time, privately, without audience. What the nod meant was, "I see you trying." That was enough for now. On the morning of his discharge, Dutton stopped his wheelchair at the nurse's station. The exact spot where the joke had started. Where Rhonda had tapped her pen, and Pete had raised his phone, and Boyce had handed over the chart with an expression that said he expected failure before the story had begun. Dutton signed and looked at Jocelyn, translate exactly every word. His hands moved steady and clear. She translated and let her voice carry through the ward. You thought silence made him diminished. You thought her gentleness made her easy to dismiss. You thought a new nurse was a safe target because she had no power here yet. He looked at each face along the nurse's station. You were wrong on every count. My silence survived things you have never been asked to endure. Her gentleness saw more than your authority ever showed you. And power was never in your titles, or your years, or your long white coat. It was always in what you chose to do when someone needed help, and you were the only one in the room. He paused, then signed one final line. Jocelyn's throat tightened as she translated. He says, you did not give Jocelyn Farr authority. She carried it in before you ever opened the door. Major Chandler, standing near the window, raised his hand in a salute. Not formal, not for the room. Just one soldier acknowledging another in the way that words were too small to manage. Jocelyn returned it. Then she lowered her hand and straightened her badge. It still read Jocelyn Farr, RN. No rank listed, no call sign. No classified commendations still sealed in a file in Ottawa that might eventually find their way out of the dark. That was enough. The policies went into writing within 2 weeks, signed by Quinn's replacement without hesitation. Every deaf and hard-of-hearing veteran at Ridgewood to receive qualified communication support. Not a cracked tablet tossed onto a bedside table. Not a whiteboard in the wrong corner of a room. No patient to be labeled non-compliant until the file documented how staff had actually attempted to understand them. No observer permitted in a room without consent. No staff member to use a patient's vulnerability as entertainment. Jocelyn drafted the last line of that final clause herself. Months later, people still told the story wrong. They said the new nurse turned out to be dangerous. They said the deaf veteran had exposed a federal cover-up. They said men with contractor badges came for a data chip hidden in a prosthetic liner. All of that was true. But none of it was the center of the story. The center was smaller and older and more ordinary than anyone wanted to admit. A group of colleagues decided that a veteran's deafness and a nurse's quietness were tools for entertainment. They expected an easy embarrassment. Instead, they learned something about themselves that they couldn't unsee, and would be carrying it for the rest of their careers, whether they wanted to or not. That was what Ridgewood Veterans Care Centre did not forget. Never mistake silence for emptiness. Never mistake gentleness for weakness. Never mistake a person's first day for the sum of everything they have already survived. Because sometimes the person everyone dismisses is the only one in the room who has already walked through the fire and knows what to do when it starts again. Sometimes the patient no one listens to is carrying the truth that changes everything. And sometimes the quiet nurse in navy blue scrubs is not hiding because she is afraid. She is hiding because the world once asked more of her than it had any right to. And then one day someone needs her again. And she steps forward anyway. That's our story for today. Thank you for being here with Steady Badges Stories. If this one stayed with you, share it with someone who needs to hear it. Drop a comment and tell me where in Canada you're listening from. I want to know how far these stories travel. Until next time, take care of each other.